My name's Grant. I'm a cancer survivor. About 2.5 years ago, I was diagnosed with renal cell carcinoma and have had my right kidney removed. And as of now, I'm cancer-free. My surgeon, Dr. Anil Kapoor, told me after the surgery was completed that there was a clinical trial available that I might qualify for. And he gave me the details, and it was something that I was really interested in when I found out. It was almost like a decision was made as soon as he told me about the trial. And I was in, provided I could qualify for it, which is what I was working on. Being involved in the clinical trial was a decision I made mostly for selfish reasons. I was interested in having as much follow-up as possible because I was worried that my cancer might come back. And I felt that this would be a way that it would be found sooner rather than later. And during the 2 years of the initial trial, I found that I learned more about clinical trials and began to realize how important it was that people were involved in clinical trials so that new drugs could come to the market. So my views changed considerably after I knew what I was involved in. Initially, when the clinical trial was explained to me, I tended to focus on the side effects that could occur. Even though we didn't know as trial participants whether we were actually taking the drug or not, there was a 50% chance we would be taking the drug. And there was the potential of significant side effects. But I think it's important to realize that the percentage possibility of those side effects were pretty low. And in 90% of the time, it was the side effects were quite mild. So, and then also as time went on, you stopped thinking about those, and you just carried on with the trial, and you didn't really look back anymore. If you're working, you have to find your way to the hospital for testing. I fortunately was retired and had lots of time, so we could come in regularly for testing, and it wasn't an issue. And the side effects problem certainly was a concern to start with, but you tend to look at it in more positive terms, and in terms of what it can do for yourself and what it can do for other people who may need that drug down the road. Being on the trial was actually a really good experience, not only from the benefits for myself, but in meeting some really good and very professional health professionals. My nurse, my doctor, my surgeon, they're all very supportive. And that was very important. Not only the doctors and the nurses, but your family was very supportive as well. Mine was, and that's very important. Clinical trials are, I think, important because, at least in this country, new drugs can't come to the market until they've been tested. And in order to test new drugs, which can have a huge impact as far as diagnosing and treating cancer, we need new drugs. And the trials are critical to that process. When I retired about 8 years ago, my initial 4 or 5 years was spent enjoying retirement, golfing and curling and being retired. And I met a fellow that I curled with, or I talked to a fellow that I curled with, and he was involved as a driver for the Cancer Society. And when he told me about it, I was quite interested in it. My mother passed away from cancer about 3 years prior to that. And so there is, and I'm sure everyone has friends or relatives that have experienced cancer in their families. So I wanted to put something back, give something back. So it was about 3 years ago I started driving, and I found out I had cancer about 2 years ago. I think when you have objectives and have goals, there's self-satisfaction in achieving some of those goals, and whether it's volunteering or whether it's in a working environment or capacity, that's probably what I got out of volunteering for the Cancer Society was sort of achieving a goal that I'd set. It's mostly fairly easy to do, but there are some times when you have to give up some time. Both my wife and I are involved with the breast cancer campaign in the town that we live in, as well as the Daffodil campaign. So we do fundraising in our community for those, for the spring and fall, for those two campaigns. And then I drive once a week, which isn't that onerous. And you know well in advance when you're driving, and you also meet some wonderful people. And they're so very thankful, you know, without exception, how pleased and happy they are that there's a service to start with, and that the drivers are so committed to helping them. There are challenges to it too, as well, and those challenges you have to just sort of deal with one by one as they come. There's people out there that think that the fundraising is going and the money's being wasted, and some people feel very strongly about that. So occasionally you'll have people say that it's not worthwhile, or it's a waste of time and money. But I don't typically get into any long arguments or discussions with those people about it. I just do the best I can at the job I'm doing, and you know, some people I've driven several times, and it's funny to see how they sort of come around and think, well, this is a program that the Cancer Society provides with very little cost to me, and being to see the value and see where some of the money goes.